In this video, we're going to focus on one of the most important skills in nursing school and what you'll find on the NCLEX, prioritization. Many students struggle with these questions because they feel like more than one answer could be correct. Oftentimes, students can get their answer choices down to two and then have difficulty deciding which one to pick. The key in understanding prioritization, it is more about deciding what is most important right now for patient safety. As a nurse, you will always have multiple patients and multiple tasks to do each shift. You cannot do everything at once, so you must decide what needs to be done first, second, third, and so on. NCLEX questions are designed to test this exact skill of prioritization. They're going to look at what is your ability to recognize the most urgent problem. The easiest way to think about prioritization is to ask yourself this: who will die first if I do nothing? This might sound a little dramatic, but it does help you focus on what truly matters. That will be patient safety and patient survival. Before you can answer any prioritization question correctly, you have to recognize that it is a prioritization question in general. You have to be able to recognize what type of question it is. Nursing exams and the NCLEX often use different wording, but they're all asking you the same thing. What is the most important action, or who is the first patient that you should do something for right now? Words like first, immediate, most, highest, or priority are very clear signals that you need to prioritize. But sometimes it'll be a little less obvious. Phrases might read, well, which patient requires intervention? Which finding must be reported? Or which patient should the nurse assess first? These are still asking you what is the most urgent situation. So when you see any of these phrases, you should immediately shift your thinking and ask, which patient is the most unstable, or which patient has the greatest risk? That is how you're going to find the correct answer. One of the biggest mistakes students make is treating every question the same when the questions aren't the same. If you miss the fact that it is a priority question, you may choose a correct answer. However, it might not be the most important correct answer. Let's make a toolbox for answering prioritization questions. There are several tools you can use to help you answer these types of questions. We'll be discussing the ABCs, what acute versus chronic means for the patient, what is an actual problem versus a potential problem, which patients are stable and unstable, how to use Maslow's hierarchy to determine prioritization, what would be a least invasive or a first action for a patient, and then also, what does a fresh post-op patient mean? Why would we prioritize their care? You will find that you will often use more than one of these at the same time, and you'll actually see some examples of that as we go through the presentation. Let's start with the ABCs. ABC stands for airway, breathing, and circulation. This is one of the most important prioritization tools. If a patient cannot maintain their airway, or they're not breathing properly, nothing else really matters. Airway problems are always the highest priority. This is then followed by breathing and then circulation. So let's talk about each one of these separately. Airway, what exactly does that mean to you as a nursing student? Well, airway problems, are the highest priority because if the airway is blocked, the patient cannot breathe at all. Examples of this would include choking, swelling in the throat, stridor, or if a patient cannot speak to you at all. If you see that a patient is not maintaining their airway, that patient should always be your first priority. Breathing comes next. These are situations where the patient is moving air, so the airway is open, but the air is not moving effectively enough. For example, you might see low oxygen saturation on a patient. The patient might experience shortness of breath, or you might even note some abnormal breathing patterns. A patient with an oxygen saturation of 88% is not oxygenating well, and they're going to need your attention pretty quickly. And lastly, circulation. Circulation problems involve blood flow. That means anything with blood flow. Simply put, is it relating back to the heart or the cardiac system? Circulation problems might affect perfusion. You might see the patient experiencing bleeding, low blood pressure, chest pain, or signs of shock like cool and clammy skin. These are all serious, yes, but they are still not as serious if there is an airway or breathing problem in the patient. A common mistake students do tend to make is they want to choose circulation problems, like chest pain, because they automatically think that's more important. However, chest pain is not more important than having a breathing problem in your patient. Remember, if your patient cannot breathe, nothing else matters. Some NCLEX tips for this prioritization strategy. Airway always comes first, even before breathing. Oxygen saturation is a big clue for breathing problems. Chest pain is related to circulation, but it does not always get prioritized before airway or breathing. And if you hear stridor, think airway emergency immediately. So let's work through this question together. We'll read the question, read our answer choices, and then I'll have you pause the video and choose your answer before I explain it. So let's look at the question. The nurse is caring for 4 patients on a medical surgical unit. Which patient should the nurse assess first? So quite frankly, when you look at the beginning of that question, the nurse will always be doing something. That is what the NCLEX is testing you on. And in this case, you're doing something for 4 patients. So this is a good indicator that this is probably going to be a prioritization question of some kind. Then it simply asks you, which patient should the nurse assess first? Now remember, first is one of our key words to know that this is a prioritization question. Take a minute to pause this video, look over it, and pick an answer. Now let's break the question down. So patient A reports chest pain rated 6 out of 10. Patient B has an oxygen saturation of 88%. Patient C has a temperature of 101 degrees Fahrenheit, while patient D is simply requesting pain medications. This is a practice of using the ABCs. So I would first ask you, is anybody having an airway issue? This would be choking, stridor. We don't have anything mentioned of that. Do we have any patients experiencing a breathing issue? Oxygenation is occurring, but it's not occurring well enough. Well, yes, that would be patient B because their oxygen saturation is at 88%. All right, so that's going to be a top priority so far. And then C is for circulation related to the cardiac or circulatory system. Patient A is having chest pain, so that could definitely be related to C in circulation. However, that still does not get prioritized over patient B. So because of the oxygen saturation being lower in patient B, that is going to be the patient that you prioritize care for. Remember, breathing issues will take priority over pain, fever, or just basic comfort needs. Your NCLEX tip. When you see oxygen levels, airway issues, or breathing problems, those are almost always your priority. When you are answering prioritization questions, one of the most important things to recognize is the difference between acute conditions and chronic conditions. Chronic conditions are things that patients live with every single day. These are expected and they're often considered stable. For example, a patient with COPD may normally have a lower oxygen saturation, like 90%. That might look abnormal for any other patient, but for that COPD patient, that's their baseline. That's where they're at every day. Acute conditions are different. These are new, sudden, or worsening changes. And in nursing, acute changes are always a priority because these acute changes indicate that the patient is starting to deteriorate. So when you are answering a question, ask yourself this: is this normal for this patient? If they give you a diagnosis and that's a chronic condition, this is probably going to be something that's expected with this patient. However, something new would be confusion, shortness of breath, or a sudden change in the patient's vital signs. This is way more concerning than a chronic condition that is stable. So, this is why acute problems will take priority over chronic ones. Let's look at an example of this. The nurse is caring for multiple patients with chronic conditions. Which patient requires immediate intervention? So, one of our special words here, immediate, meaning you should do this right away. They should be seen first. Pause and choose your answer. Looking at the answer choices, patient A has COPD, which is a chronic condition, and has a baseline oxygen saturation of 90%. Now, in nursing school, you will learn what COPD is and what those baseline assessments are. This is a baseline, normal, stable condition for a patient with COPD. Patient B also has COPD, but they're newly confused, and that newly word should be a trigger point. Newly meaning this is a new change, something that has not been chronic. So we definitely want to keep patient B at the top of our list right now. Patient C has diabetes, and they are requesting a snack. Well, diabetes is also considered a chronic condition that the patient can control with medications. Requesting a snack is simply just requesting a snack. Patient will not die at the moment if they don't receive their snack. And patient D has hypertension. Again, can be another chronic condition, and their blood pressure is currently 150 over 88. Well, they have hypertension. We do expect their blood pressure to be high. So at some point, we're probably going to give them their medications, but their blood pressure is not in urgent need of being lowered. So in this question, patient B with the newly onset of confusion, that's going to be our acute change where everything else is just chronic conditions, and patient B will need our immediate intervention. NCLEX tip for this is they will try to trick you with chronic conditions that look bad, but the new change is what matters most. When you are answering prioritization questions, another important concept is the difference between an actual problem and a potential problem. An actual problem means the patient is currently experiencing an issue right now, in the moment as you're looking at them or assessing them. A potential problem means the patient is at risk for developing a problem, but it hasn't happened yet, nor would we know if it ever will happen. In nursing, we always prioritize what is happening right now over something that might happen later. And I use that word might because something could happen 5 minutes from now or 5 days from now. And I'm not going to be concerned about that something that's happening 5 days from now just yet. For an example, a patient with a fever already has a problem that needs intervention. So we would need to give them some medication to lower their fever. A patient, though, that is at risk for infection does not have a problem. We're just going to continue to monitor and prevent that infection. So when you see answer choices, you'll want to ask yourself this: is this an actual problem that I need to do something for right now? Or is it just a risk? The actual problem will almost always be the priority because it requires immediate action. All right, let's take a look at this question. The nurse is reviewing patient conditions on the unit. Which patient should the nurse prioritize? Pause and choose an answer. Patient A is at risk for infection. Is the infection actually happening, or is there just a risk for it? Patient B has a temperature of 102 degrees Fahrenheit. Definitely an elevated temperature. What do elevated temperatures mean for us as nurses? Infection, viral illnesses, lots of different things. Patient C is at risk for falls, hasn't fallen, but could fall. And patient D is at risk for impaired skin integrity. So maybe we just need to reposition them, but they're not actually having any wounds or skin ulcers on their body. So, of these four patients, ask yourself which patient has an actual problem right now that you can do something for. And your answer should be patient B, the patient with a temperature of 102 degrees Fahrenheit. This fever is an actual problem. That actual problem means that the body is already responding to something. So you're going to have to start to treat that problem. NCLEX tip: risk for answers are often distractors. They're going to get you to think something's going to happen. However, we need to look at what is happening right now with the patient. Stable versus unstable. Stable patients are predictable. They're not changing. Their vital signs are staying the same all throughout the shift. They are alert and oriented times 4. Talking to you, nothing seems off, and everything has been the same that it has been for hours. Unstable patients, though, they have changes. Their vital signs will change, their level of consciousness will change, or they might start to have some new symptoms of conditions that weren't there before. Unstable patients will always be your priority when you're looking at stable versus unstable. For this question, the nurse is assigned to 4 patients. We have our 4 patients again. Which patient should the nurse see first? Pause and choose your answer. Now, the key here with looking at all of these patients is going to be what kind of setting are they in? Are there any new changes? Remember, what makes a patient unstable versus stable? New changes makes them unstable. Patient A is a post-op patient, and they're ambulating on day 3. I would say that's fantastic. Keep it going. Just keep doing what you're doing. Patient B has stable vital signs. Blood pressure is 118/70. Love the blood pressure, and it even was nice enough to tell you that that is stable. You didn't even have to recognize if that blood pressure was normal. Patient C has a sudden drop in blood pressure to 88/50. Now that blood pressure is low. Don't really like that. And it tells you sudden drop. New changes. That could mean instability, or the patient is starting to become unstable. So let's put that at the top of my list right now. And patient D, well, they just want to be prepared for discharge. So they must be pretty good and ready to go home. So for this question, I'm going to go with patient C is the first patient I need to see because of that sudden drop in blood pressure. There's been a new change, and therefore they might actually be unstable now. Maslow's hierarchy. This is another tool that helps us prioritize patient care by focusing on basic human needs. So the most important level is the physiological needs. Fancy word to say everything that the body needs to survive, like oxygen, circulation, fluids, and nutrition. If these needs are not met, the patient simply cannot survive. So they will always take priority over everything else. These basic needs have to be met before the patient can feel safe, before the patient can feel like they're belonging somewhere, or before their self esteem can improve. They have to be able to breathe, eat, and function within the actual human body. Airway and breathing are part of those physiological needs, which is why they're always our highest priority, even with A, B, and C. A key um, teaching point I would make here is that on nursing exams, Maslow is often used to help you choose between two answers where both might seem correct. So you want to ask yourself which answer addresses a basic survival need. So which one is going to address those basic physiological needs that helps this patient actually survive, not just be safe. Your NCLEX tip: physiological always beats out psychosocial. And psychosocial will be those emotional, loving, belonging concerns. Pain is considered physiological, but it's still going to come after airway and breathing. Pain is not prioritized above airway and breathing. Safety comes after physiological. So once those physiological needs are met, then we focus on the patient's safety, and then eventually, we'll focus on esteem or emotional needs. A very common mistake that students do is they'll want to choose an emotional or a comfort-based answer. For example, like treating the patient's anxiety or giving the patient education, but there's a physiological answer that should be picked instead. So on your exams, the physical problem or the physiological problem will almost always be the priority choice. All right, so let's look at a question from Maslow's. The nurse is prioritizing care for 4 patients. Which patient is the highest priority? Highest priority meaning which patient do you need to see first? Who is the sickest? Who needs the most from you? Pause and choose your answer. Is it going to be a patient experiencing feelings of loneliness, a patient reporting pain, 5 out of 10, a patient experiencing shortness of breath, or a patient requesting education about medications? Now, this is using Maslow's. You might also find that you can use your ABCs here. A, though, feelings of loneliness, although that is important at some point, we have to make sure that the patient is breathing and has all of their physiological needs met before we are concerned at all about psychosocial. So A definitely would not be a priority at the moment. B, they're having pain. It's rated 5 out of 10. It's moderate pain. I would say that's a priority as of right now, but let's see what else comes up. Patient C is experiencing shortness of breath, though. All right, so shortness of breath would be breathing, airway. That would be a physiological need. I'm thinking that's going to trump my pain, so I'm going to put shortness of breath at the top of my list. And then patient D is requesting education about medications. Education will always be a last factor with risks because if they can sit and get education, they're probably ready to go home and they're stable and they don't need us much for anything. So the correct answer here, who needs your highest priority? That is going to be patient C that is experiencing shortness of breath. And that is because it is a physiological need and that requires much more action on your part. All right, fresh post-op. So this is going to be a patient that is within the first 12 hours of coming out of surgery. During these first 12 hours, they are at their highest risk for complications like blood clots, pneumonia, bleeding, shock, and even airway issues. So this is why we have to monitor these patients extremely closely. And for this practice problem, the nurse is caring for postoperative patients. All right, so we have our setting here. So we're post-oping patients. Which patient should the nurse assess immediately? So something's going to be changing here, probably with these post-op patients. They've had surgery, but we're keeping an eye on them. Let's look at some answer choices and see what we would pick. Pause and then come back when you're ready. We have patient A who is 2 hours post-op with a decreasing blood pressure. So I would say look at the timeline here. We know that fresh post op patients are less than 12 hours out of surgery. This patient is 2 hours, so they're definitely fresh. So that's going to be on my note to kind of circle, highlight, and for me to understand that they are a fresh post op. There might have some changes, and I need to keep an eye on it. And did this patient have any changes? Their blood pressure is decreasing. So right now, this is my star patient. This is the one I'm going to see first unless something else comes up. Patient B is 3 days post-op. Well, they're not a fresh post-op patient, and they're ambulating in the hallway. That's what we want to see. That's expected. They're doing fantastic. Keep letting them walk. This is not a priority for me. Patient C is requesting pain meds. All right, perfect. They are going to have pain after surgery. I'll give him some pain meds when I eventually get to it or when they're scheduled, but it's not a priority. Patient D needs discharge teaching. All right, so what do we know about discharge teaching? Discharge teaching, they're probably stable. They're ready to go home. They don't need much from me, so they're not my priority. In this case, patient A, who is a fresh post-op patient, just 2 hours out of surgery, is starting to have a blood pressure that is decreasing. That is who I have to care for first. Acute changes, this could indicate bleeding or shock, anything life-threatening. So I just need to be very aware and prioritize this patient first. NCLEX tip for post-op care, early post-op that has any sort of vital sign changes that are not for the good. We're going to think either bleeding, hemorrhaging, or possible shock. So those patients need to be prioritized first. All right, and our last kind of go-to tip here is who is the sickest versus the healthiest. This can go two ways. One, the question might ask you, who is the sickest patient? So who should you see first or do something to first? Or they could actually reverse this question on you and say, well, who's the healthiest? Now that kind of feels weird because we don't usually worry about the healthiest as nurses because that's good and they're going home. But in cases like mass casualties where hospitals are going to be receiving a lot of injured patients and we need to clear out the hospital and send the healthy ones home, you might be asked to figure out who is safe to discharge. So those would be those healthy patients. Our review question for this: the nurse is assigned to 4 patients. Which patient should the nurse attend to first? Pause and come back when you're ready. Patient A is reporting chest pain. Patient B has a fractured arm. Patient C has some nausea. And patient D is awaiting discharge instructions. So let's just start at the bottom. We've had this one enough. Discharge instructions, that's not a priority. Patient's ready to go home. I would not go see them first. Patient C is having some nausea. Well, they are sick, but are they sick? So let's look at our other patients. Patient with a fractured arm. Well, fractured arm, are they having pain? What sort of fracture is it? Will they need surgery? Is there any other symptoms? Just very basic fractured arm. Is it related to airway, breathing, circulation? Not necessarily, so they might not be the sickest yet. And then patient A is reporting chest pain. Now, where does chest pain fall in our ABCs? It falls at C under circulation. So fortunately, patient A is going to be the one we see first because they're falling within the ABCs, and that's going to put them as the sickest at the moment. So let's put this all together. When you see a prioritization question, you'll need to ask yourself, is there an airway or a breathing issue? If there is, that's a priority. Is there an acute change in my patient? Something new? Is this an actual problem or is there just a risk for the problem? The actual problem will always take a priority. Is the patient unstable? Remember, are those vital signs changing? And is this a fresh post-op patient? Have they been out of surgery less than 12 hours and they are at the highest risk for post-op complications? The more yes answers you have for an answer choice, the higher that priority will be for the patient. So, prioritization is not about just guessing. It is about using a structured way of thinking, using all of those tools that we had in our toolbox. The more you practice, the easier it becomes to recognize what matters most. So, doing questions over and over really does help you understand prioritization. However, you can always come back to this question. On every prioritization question, ask, who is the most unstable right now? If you don't like that question, ask yourself, who would die if I don't do anything at this moment? One of those patients might be worse than the other one. That is the patient you are looking for. To continue to set yourself up for success in nursing school, check out the video on how to think through nursing school questions to help you understand how nursing instructors will be testing your nursing knowledge.